Good evening. Good evening, Philippines. Kumusta po kayo? Oh my God. Nakakaloka. It's been a while. Ang tagal kong nawala. Ang tagal kong hindi nakapag Facebook Live at saka nakapag-stream. Finally, I am back, guys. Kumusta po kayo? I was out for a couple of months. Siguro mga 6 months ako nawala. Why? Malayo kasi yung yung assignment ko for those who are new to this stream. My name is John. I'm giving sometimes a live lecture for the NCLEX-RN examination or any qualifying examination for nurses. And I am working here in the US as a traveling nurse. So katatapos lang po ng aking contract the other day. Natapos po siya nung July 13. And then buong araw ako natulog kahapon. Tapos sabi ko, oh my God, I owe a lot of explanation, and at the same time, yung mga estudyante ko nag-aabang na sa mga updates. So ito yung pambayad ko sa inyo, guys. So yun nga, no? So katatapos ng contract, and then ngayon, I'm on break. So I will take a break for about 2 or 3 weeks. And then after that, magre-resume yung another contract ko. Panibagong contract this coming July 29. So I'll be going to Arizona sa July 29. So I'm excited for this new contract kasi nga it's a new place, a new facility, and then I'll be dealing mostly with Native Americans. So it's a new challenge for me. So anyway, kung nabasa yung concept, we'll talk about edema formation, and we will incorporate this in your NCLEX-RN exam. Now, bakit ba napili mo, Sir John, yung edema formation? Because it's so timely, because the last patient I had, meron siyang liver problem, and he ended up having a lot of fluid in the body. At saka nangyari is, nagmamanas siya. So sa sobrang dami ng tubig, so, syempre, wag ka ng weight gain, nahihirapan siyang huminga. It's all because of liver issue or liver problem. Hold on. So, yun ang pag-uusapan natin ngayon, yung mga edema formation, okay? Isang saglit lang. Nakastream po tayo ngayon sa Facebook, sa TikTok, where else? Instagram, and YouTube. So magandang gabi po ngayon sa Pilipinas. Anong oras na ba sa Pilipinas? I think it's almost 8 o'clock in the Philippines. Ngayon po dito sa akin is 7:80 ng umaga. Hindi pa ako natulog. I don't know why. This is actually one of the reasons na maraming nurses ayaw mag-duty paggabi. I've been working night shift for quite a while. So yung sleep pattern ko disturbed na siya, hindi na siya normal. So technically, gising ako paggabi. So, matutulog ako mamaya siguro mga around 10 o'clock. Mga umaga, my time. And then, gising ako mamayang hapon ng alas 4. Anyway, guys, if you have any questions or any concerns about the topic, feel free to drop a message. Nababasa ko po yung mga comments. And then, I'll try to answer the questions, okay? Okay, so let's talk about edema formation, and we'll incorporate this in your NCLEX-RN exam or any qualifying examination for nurses. May it be in the Middle East, you have your DHA, HAAD, Prometric, or in the Philippines. Or by the way, bago ko makalimutan, congratulations pala sa mga bagong nurses sa Pilipinas. Ayan, okay? Congratulations. Yung mga bagong pumasa lang sa nurse licensure examination sa Pilipinas. Congratulations po. Ayan. So, tingnan natin. So, let me share my screen, guys, and then we'll talk about edema, okay? Where is that? There. Okay, so let's talk about edema. What is edema? Okay, saan nagagana 'to? Alam mo honestly para ako nangangapa sa tagal kong nawala, para ako naninibago sa configuration tsaka mga buttons dito. Anyway, so we'll talk about edema. Hindi po yan pangalan ng tao, okay? So what is edema, Sir John? Edema is actually a term that describes swelling because of fluid accumulation or fluid buildup in the tissue. Okay, so technically this is swelling. Okay, swelling due to fluid. Okay, where in the body tissue or in the tissue. Especially if the fluid is in excessive amount, if there's too much. Kasi normal po na may fluid in between, right? But if there's too much fluid in the tissues, so that will result to edema formation. So anyway, for us to better understand what edema is all about, you need to go back to the basic. This is one of the most important thing that I always say to all nurses who are planning to take any qualifying examination. Ang dami pong concepts sa nursing, okay? Let's be honest. Hindi po natin kayang i-memorize lahat. Okay, so the most important thing to do here is to go back to the basic, understand the basic. Because if you don't know the basic concept, so mahihirapan ka na sa complexity ng concepts ng nursing. Meron kang pharmacology, meron kang pathophysio, meron kang medical surgical nursing. So always go back to the basic para hindi ka mahirapan sa mga concepts. The technique in your nursing licensure examination is actually not to memorize the concept, but to understand the concept. Okay, so this is the normal physiology or the basic or the fundamentals of your fluid compartment. Okay, so alam natin that the heart, okay, main function of the heart is actually to pump the blood out. Okay, that's very basic. Ang ganda ng heart dito. Okay, so the heart is divided into two sides. So you have the right side of the heart and the left side of the heart. Okay, we know that the right side of the heart is the side of the heart that receives and pumps deoxygenated blood or a poorly oxygenated blood. The left side, on the other hand, is part of the heart that receives and pumps richly oxygenated blood. And when the heart pumps the blood out, that blood enters a closed circuit. Okay, that closed circuit is what we call blood vessel. Okay, a blood vessel connected on the left side, ang tawag natin sa blood vessel na nasa left side ng heart connected is what we call artery. Okay, a small artery is what we call arteriole. A blood vessel connected sa right side ng heart, you call this a shear vein. Okay? A small vein, we call that a shear venule. The junction between a vein and an artery, okay, or to be specific, your venule and arteriole, is a small blood vessel. We call this a shear capillary. Okay? Now, here's the situation. When the left side of the heart pumps the blood out, that blood enters an artery. And that blood flow here, the direction here is away from the heart. So the blood enters the artery, goes to your arteriole, enters the capillary area, and then it reaches this side, the vein. Okay? The vein now carries the blood back to the heart. Simple. Okay? So this is the cycle. If you're going to discuss this in detail, this will be under your cardiopulmonary circulation. Okay? Now, hold on. Now, when the blood enters the capillary area, remember that the capillary membrane is so thin. Masyado manipis yan. Sa sobrang nipis niya, it's possible for substances, for gases, for nutrients to pass through or pass across the capillary bed, okay, or the capillary membrane. Okay, by virtue of a principle called diffusion. If you can remember this, diffusion refers to movement of molecules from a higher to a lower concentration. Okay, so ibig sabihin, okay, you have here your cells. Okay, you have here your cells. Inside the cell, there is a fluid. Lakihan natin. Inside the cell, okay, inside the cell, there is a fluid called ICF or intracellular fluid. It is the fluid inside the cell. Outside the cell, there is another fluid compartment called ECF or your extracellular fluid. Okay, so you have your ICF here inside the cell and outside the cell, you call that as your ECF. Your ECF is divided into two. You have your plasma, and then you have your interstitial. Remember that your plasma is a type of ECF that can be seen inside the blood vessel. That is why another name of plasma, okay, another name of plasma is your intravascular fluid. It is the fluid inside the vascular compartment. Another name of your interstitial, since interstitial can be seen outside the vascular compartment, we can say that interstitial, you also call this as your extravascular fluid. Okay? So here's the thing. When the blood, okay, passes the capillary area, okay, remember it's a fluid, it exerts a pressure against the wall of the blood vessel. You call that pressure exerted against the wall as your hydrostatic pressure. The more blood you have in the vascular compartment, the higher is the hydrostatic pressure. That is why if you drink a lot of water and you don't pee, water stays in the blood, increasing the blood volume, increasing your blood pressure. Okay? The more water you have, then the higher the pressure you get. Because the more blood, then the more fluid you have, then it increases the hydrostatic pressure. When that pressure increases, it pushes the fluid out. Okay, it pushes the fluid out. And that fluid that gets out from the vascular compartment joins the interstitial environment. Okay? Now, when that interstitial volume increases more than what is ideal, okay, that will result to a condition called edema formation. Okay, so technically, when you say edema, it is a swelling due to fluid accumulation or fluid buildup in the tissue more than what is expected. Now, since the heart pumps the blood out, is it expected for the fluid to get out from the vascular compartment? The answer is yes. So normal pala talaga, surgeon, na may lumalabas na fluid? Yes. So kung normal na may lumalabas na fluid, bakit wala akong edema ngayon? Because other structures will compensate. There are a lot of conditions, factors, physiologic adaptation to prevent edema. Okay? One of the most important, what do you call this, adaptation here, okay, is your lymphatic system. Okay? So meron tayong lymphatic system. Burahin muna natin itong edema na nakalagay dito. So here is your lymphatic system. Okay. So this is your lymphatic system, this part here. So this is what we call your efferent. This is what we call the afferent. This is what we call the lymph node. Remember, when interstitial volume increases, or shall we say when fluid is in the interstitial space, your lymphatic system joins or helps the circulatory system. How? By draining the excess fluid, draining excess protein, and then when that fluid enters the lymphatic system, you call that as your lymph. Okay? It passes the lymph node. Ano ang gagawin niya sa lymph node? The lymph node now will filter the lymph, that fluid. Okay? Once malinis na yung fluid, it is now directed back to the circulation. Ngayon, pag ang patient may infection, expected na mamamaga ang lymph nodes. Okay? Because once it filters, it will also filter microorganisms, foreign substances, causing inflammation of the lymph nodes. We call that as your lymphadenitis. Sa Tagalog, ang tawag natin dyan, kulani. Am I right? So pag ang patient may lymphadenitis, may kulani, that is one indication that most likely patient is suffering from having infection. Okay? That could be one indication. So ibig sabihin, pag yung patient natin dito, impaired ang lymphatic system, impaired ang lymphatic channel, the ability of the lymphatic system to help circulatory system now is impaired, it will not allow draining of water or fluid or protein back to the circulation. As a result, pag impaired yan, barado yan, tataas ngayon ang interstitial volume causing edema. The cause of edema here is lymphatic obstruction. So we call that as lymphedema. Give me one example that there is edema brought about by lymphatic obstruction. One good example here is a communicable disease common sa mga tropical climates, sa mga third world countries, just like Philippines, no? Common sa atin, may mga cases tayo ng tinatawag natin filariasis. Okay? Remember, the causative agent is your microfilariae, the filariasis. And then what will happen is that they will migrate here in the lymphatic vessel, causing obstruction. As a result, hindi madrain ng lymphatic channel ang interstitial back to the circulation, causing, of course, edema, lymphedema. Kaya nga a patient with filariasis, kinagkakaroon tinatawag natin kondisyon na elephantiasis, okay, which is actually a presentation of your lymphedema. Okay, so that's one reason. Now another thing, in the blood, there is protein in the blood. Okay, there is protein in the blood. I am talking about albumin. Okay, remember that albumin is a form of protein. Okay, now what is the relevance of your protein? What is the relevance of your albumin? Hold on. Let me check first kung gumagana pa ba yung aking stream. Hold on. Yes, gumagana pa. Hold on, may mga nagpapabate. Hello, sabi daw ni hi, sabi ni sir. Yes, sir. Sabi ni Juliet. Hoy, Ate Juliet, kumusta? Hello to Rica Bringuelo and Miriam Mauleon. Yeah, and hello to Kent Lagayada. Good morning. Kung saan kayo, kung nandito kayo ngayon. But anyway, let's go back. So yun na, ano? So albumin is a form of protein. And what is the relevance of this albumin? Albumin as a protein maintains oncotic pressure. Okay, so this protein has something to do with oncotic pressure. So what is oncotic pressure? Oncotic is a pressure that holds the fluid to stay inside the vascular compartment. Okay, again, it is a pressure that holds the fluid to stay. It holds the fluid to stay inside the blood vessel. So it's one way of telling, hey, water, do not get out. You stay here inside. So that is your albumin. So technically, yung albumin na yan, hindi niya ipapalabas ang tubig. It will let the water stays inside the blood vessel. Pag yung pasyente po natin may nutritional deficiency, so this is a dietary condition, a dietary concern. If you don't eat protein-rich foods, okay, bababa po yung albumin natin. As albumin decreases, the oncotic pressure decreases, causing fluid shifting. Okay? So magsisilabasan yung fluid, resulting again to edema formation. Okay? So hindi lang po dietary concern, but also patient having liver issue. Okay? Remember, if you have liver issue, that one concern or one problem associated to patient with liver problem is hypoalbuminemia. Kaya nga, do not be surprised to patient with liver issue, we give albumin infusion. Kasi nga, nagkakaroon sila ng hypoalbuminemia. Okay? So technically, alam na natin na ang edema, technically, there is swelling due to fluid buildup in the tissue. So let's identify what causes edema. Okay, what causes edema? What causes edema? Number one, immobility. Immobility. So if you don't move, okay, so if you don't move, what will happen? Paano ba yan? So what will happen if you don't move? If you don't move, the muscles will not contract. Okay, remember, importante po yung muscles na mag-contract. Why? When muscles contract, they will squeeze the blood vessel, promoting circulation. Okay? Kaya nga, long-distance driving is not advisable na walang break. Dapat every 2 hours, you pull over, get out from the car, you stretch, you move. Because muscle contraction will promote circulation. Okay? So another thing, Ano pa ba? Yung mga bedridden patient natin, kaya nga importante sa mga bedridden na pasyente, igalaw-galaw natin yung mga paa, igalaw natin yung kamay nila. There must be passive movement. Okay? Active movement or passive movement. Depende sa case ng pasyente. Importanteng igalaw. Or in the hospital, meron po tayong compression device. Okay? Yung nilalagay natin sa calf ng pasyente na nagsisqueeze sa calf ng patient, importante yan. Your sequential compression device will promote circulation. Remember, if there's good circulation, it prevents clot formation. Okay? So, importante yan. So, immobility is one reason why you end up having edema. Hindi nyo ba napansin, pag sumasakay ka ng aeroplano tapos long distance flight, okay, namamaga yung paa natin, namamaga yung binti. So, sitting for long period of time, laying on bed for long period of time, what else? Immobility, technically, immobility will promote edema. So, the edema here usually can be seen kay saan po? Sa ankle, sa lower extremities natin, sa mga lower part ng katawan. Okay? So, that's one reason, edema. The second cause of what do you call this? The second cause of edema is what we call dietary. Where is that? My God, please bear with me. Naninibago ako sa aking computer. So the second cause is, number 2 is, ano nga sabi ko? Dietary. So what specific diet will increase the risk of edema? Number 1 is if you consume a lot of sodium. High sodium intake. Remember, sodium attracts water. So if you eat sodium-rich foods, so chances are you attract water, causing fluid buildup, causing edema formation. Okay. Now another dietary concern that can lead to edema formation is a deficiency in your protein. Okay, nabanggit na natin to. Why? Remember, protein, we're talking about albumin. So if you have protein deficiency, that can result to hypoalbuminemia. A decrease in the albumin will result to decrease oncotic pressure, resulting to fluid shifting, giving you edema formation. Okay? So not only edema formation for high sodium intake, it will also increase the blood pressure of your patient. Kaya nga, tandaan, if you are hypertensive, avoid salty foods because the more it increases your blood pressure. Nagsalita ang hindi hypertensive. Next, number 3. Another cause of edema is a pregnancy. Do you know that if you're pregnant, napansin niyo ba? Sino na ba dito nagbuntis na? Napansin niyo mga nagbuntis, nagmamanas yung mga paa nila. Okay? Sir, why? Why is it pregnancy can cause edema formation? What's with pregnancy that can cause edema? Well, there are physiologic changes during pregnancy. Okay, there will be hormonal changes during pregnancy. Isa sa mga effect ng pregnancy is that, number 1, pregnancy, the hormone, okay, will promote water retention. Okay, so again, just like your sodium intake, if there's too much sodium, then the more water retains. Same with your pregnancy. In pregnancy or during pregnancy, there is a hormone there that promotes water retention. So water retention can result to edema formation. Another cause of edema brought about by pregnancy is that when you are pregnant, as the baby or as the fetus develops in the uterus, so lumalaki po yung uterus natin, diba? Lumalaki po yung uterus ng babae, di ba? So as the uterus increases its size, it adds pressure in the pelvic floor. Okay? So because of pressure build up, mahihirapan po yung dugo na bumalik sa heart galing sa paa. So ibig sabihin, as the uterus increases its size, the pressure in the pelvic floor increases due to increase in the size of the uterus. As a result, yung blood sa paa ng pasyente, yung blood, yung fluid sa paa ng buntis, mahihirapang bumalik sa heart to be circulated. Kaya nga, expected pala na nagkakaroon ng pagmamanas yung buntis sa paa. So I just want to make it clear. Expected po na magkakaroon ka ng edema sa paa pag buntis. But if edema, don't forget this in NCLEX, if edema can be found sa face ng buntis or sa hands ng buntis, that is not a good indication. That could be an early warning that the patient is experiencing a condition called pregnancy-induced hypertension or PIH. Remember sa PIH, pwede ka magkaroon ng facial swelling or swelling puffiness ng kamay. Kaya nga, di ba, isa sa highlights sa NCLEX natin, if a pregnant mom will tell you, oh my God, my wedding ring, I can no longer take it off because namamaga yung fingers niya. So that's a heads up in your NCLEX. So pag namamaga ang kamay, namamaga ang arms, namamaga yung mukha ng buntis, that's not a good sign. Pero pag namamaga yung lower extremities, that is kind of expected. Okay? Now, another reason bakit nagkakaroon ka ng edema sa buntis is that same same principle. Pag lumalaki yung uterus ng babae, there is a risk na maiipit niya yung vena cava. Okay? Especially the inferior vena cava. So pag naipit yung inferior vena cava, that will impede the venous return, okay? Causing congestion of fluid. Okay? Causing congestion of fluid, again, leading to edema formation. So again, those are 3 reasons why, okay, or factors why during pregnancy there is edema formation. Number 1, hormone that promotes water retention. Number 2, pregnancy will increase pressure in the pelvic floor due to increase in the size of the uterus, causing problem or difficulty of blood or fluid to go back to the heart. And number 3, because of increase in the size of the uterus, there is a risk or likelihood that as the size increases, it will also compress the inferior vena cava, impeding circulation or blood return. Okay, so that's the reason why pregnancy can cause edema formation. Now, what else? So another cause of edema, number 4, another cause of edema is meds. There are medications that once given to your patient, you need to watch out for edema. So ano yung mga medication? For example, yung mga blood pressure medication. BP meds, what else? Yung mga pain medication natin. So, example ng mga BP meds that you have to watch out for edema, yung mga beta blockers, or patient taking amlodipine, okay? So, you need to watch out for edema formation. Isa yan siya sa mga side effects, okay? And of course, pain medication as well. Number 5, another cause of edema will be medical conditions. Medical conditions. Now, what medical conditions can result to edema formation? Okay, give me an example of a medical problem. Okay, letter A is your congestive heart failure. Now, what is congestive heart failure? Congestive heart failure refers to inability of the heart to pump well. Remember that the primary function of the heart is to pump the blood out. So if your heart cannot pump well, so remember, going back to this drawing, so the heart is divided into 2 sides, right? So you have the right side. The right side of the heart will pump the blood going to your lungs. Okay? So ibig sabihin, if the right side of the heart will not pump well, okay, hindi siya mag-pump, hindi makalabas yung blood from the right side of the heart. Mapupuno, magko-congest yung blood, yung fluid sa right side. So pag napuno ang right side ng heart, hindi makapasok yung blood na nanggagaling sa systemic circulation, causing systemic congestion. There will be systemic edema formation. Okay? Now, what about left-sided heart failure? Pag ang patient po may left-sided heart failure, ibig sabihin that the left side of the heart is not pumping well. We know for the fact that the left side of the heart is the side that pumps blood to the systemic circulation. So pag nag-left-sided heart failure yan, hindi nag-pump ang left side ng heart ng maayos, magko-congest yung blood on the left side. Okay? Causing what? Backflow, so leading to pulmonary congestion. So, ibig sabihin, bakit pulmonary congestion, Sir John? Remember, the blood that enters the left side of the heart is a blood that came from the lungs for oxygenation. So, left side of the heart is not pumping well, causing congestion. As a result, the blood in the lungs, will accumulate there because it cannot get inside the left side of the heart because the left side of the heart is congested, right? So, resulting to pulmonary congestion. So, either way, maybe right-sided heart failure or left-sided heart failure, they both cause congestion. They both cause edema formation. Kaya nga, ang highlights sa NCLEX dito, what heart failure causes systemic congestion? What heart failure causes pulmonary congestion. So the answer, a heart failure that causes systemic congestion is your right-sided heart failure. And your left-sided heart failure causes pulmonary congestion. Okay, pulmonary edema. Okay, so that's okay. That's number one, or one medical condition. Now, another medical condition that can cause edema is patient having renal failure, or shall we say renal dysfunction. Remember that the kidneys play a vital role with blood pressure regulation, electrolyte balance, water balance, okay, and all those stuff. So the kidneys will play has a significance to both excretory and non-excretory relevance. So pag yung pasyente natin may renal failure, yung ability ng kidneys to get rid of water, to get rid of excess electrolytes, affected yon. That is why kung napansin mo, lahat na pasyenteng may renal failure will end up having hypertension. Why? Bakit nga ba hypertensive yung pasyenteng may renal failure? Because if you have renal failure, the ability of the kidneys to get rid of too much water is impaired. Remember, what did I tell you a while ago? If there's too much water in the body, the hydrostatic pressure increases, okay? The blood pressure increases. So one common vascular complication of renal failure is hypertension. Okay? Now, another thing, pag yung patient may renal failure, hindi niya may papalabas yung tubig, okay, hindi may papalabas yung electrolyte. So same thing. If those excessive substances or excess substances are retained in the body, it will give you, of course, an ill effect. Whether it's electrolyte imbalance, the other one is fluid volume excess. Okay, nabanggit ko na. Inulit ko lang. Anyway, now another medical condition is liver failure. Oh, ito yung condition ng pasyente ko. Liver failure. So why can liver failure cause edema? Remember, the liver, as the largest gland in the body, it plays a vital role for metabolism. Okay? So if you have liver problem, so isa sa mga komplikasyon ng liver failure, liver dysfunction, especially on the later part, late part of liver damage, which is your hepatic encephalopathy, tumataas po ang ammonia level, bumababa po ang kanyang what do you call this? Ang kanyang albumin. So a patient with liver problem will end up having my God. Ang pasyente po na may liver problem will end up having, sa later part will end up having too much ammonia in the blood, okay? And a decrease in your albumin in the blood. So gaya ng sinabi natin kanina, when albumin decreases, it decreases oncotic pressure, causing fluid shifting. Kaya nga sa mga pasyente may liver problem, we give albumin infusion. Eh sa pag tumataas yung ammonia level ng pasyente, anong gagawin natin? We give lactulose. So a lactulose will be given for the purpose of decreasing blood ammonia level, because if there's too much ammonia in the blood, it will cause altered level of consciousness, okay? It will affect patient's cognition, it will affect patient's mentation. So marami siyang problema that will accompany because of too much ammonia. So how do we give lactulose? Lactulose can be given oral, or lactulose can be given enema. Okay, so yun. Another medical condition that can cause edema, letter D, is your DVT, or deep vein thrombosis. Okay, deep vein thrombosis. Now, why? Remember, if the vein is occluded, remember I mentioned this a while ago, the vein carries blood back to the heart. If the vein is occluded, okay, the direction of your blood flow dapat pabalik sa heart, but because of occlusion, mahihirapan yung blood to go back to the heart, causing what? Congestion here in the capillary area, causing again fluid shifting. Okay? Apart from that, okay, is what we call your varicosities. Varicosities can cause edema as well. Varicose, okay, is a problem, a condition affecting the vein. Remember, lalo pag nasisira yung valve ng vein natin. Remember, the valves will promote unidirectional flow. So pag yung pasyente natin nasisira yung valve, okay, that can cause what do you call this? Para siyang reflux, okay? It will not promote good unidirectional flow. So this will result again to what we call edema formation. Kaya nga, pag yung mga pasyente natin may varicosities, may DVT, isa sa mga importanteng tandaan natin dito is you need to elevate the affected extremity. Why will you elevate? You elevate the affected extremity to promote venous return. Okay? So technically, ito po yung mga common causes ng edema formation. Okay? Common causes ng edema formation. Okay, wait lang. Hindi ko nakikita yung sarili ko. There. So those are common causes of edema. Bakit nagmamanas yung mga pasyente natin? Okay? So how do we treat patient with edema? Number one, of course, there will be dietary modification. Okay? So you need to limit water intake of your patient. Okay? So kung kanina, sabi natin, pag inom ka ng maraming tubig, hindi ka naman umiihi, it can cause water retention. So this time, you have to limit water intake. That is why, pag nasa hospital tayo, we need to collaborate care, okay, with different healthcare team. We do not just manage the patient all by ourselves. Okay, all nurses lang. We collaborate with PT, we collaborate with OT, we collaborate with the nutritionist, dietitian, we collaborate with RT, we collaborate with member ng healthcare team. Dito importante na marunong kang makiusap sa mga members ng healthcare team. So you have to collaborate with other members. Okay? Kaya nga sinasabi namin dito, no profession is greater than the other. Okay? Bakit? Kanya-kanya tayo makanya-kanyang responsibility. Okay? So anyway, number one, so mayroon tayong dietary modification. So you have to limit water intake. Tell your patient to avoid sodium-rich foods. Okay. Number two, we also give diuretics. So why do you have to give diuretics? To promote water elimination. Okay. So in your NCLEX, remember there are two common types of your diuretics, the two major classifications, whether it could be potassium wasting or potassium sparing diuretics. So when you say potassium sparing diuretics, these are diuretics that will spare potassium, causing or increasing the risk of hyperkalemia. Okay, pero it will cause hyponatremia. So what are examples of potassium sparing diuretic? Ano ba yung mga potassium sparing? Ito yung mga spironolactone or aldactone, amiloride, triamterene. These are examples of potassium sparing. So yung other classification naman natin ay potassium wasting diuretics. These are diuretics that will promote potassium loss. Okay, ilalabas yung potassium. So increasing the risk of hypokalemia or mababa yung potassium in the blood and hyponatremia. So what are examples of your, what are examples of your potassium wasting diuretics? You have your Bumex, you have your Lasix or your furosemide, you have your HCTC, that's your hydrochlorothiazide, and you have your mannitol. Mannitol is a form of osmotic diuretic na common binibigay sa mga pasyente natin na may cerebral edema. Okay? So those are common treatment or mga management natin sa pasyenteng may edema. As a nurse, importante pong tandaan na if yung patient po natin risk for edema or ma-edema formation, you need to raise or elevate the head of the bed. Why is it important for us to elevate the head of the bed? Because pag yung may patient po natin na may fluid volume excess, there is always risk of pulmonary congestion. Okay? So, pwedeng mahirapang huminga yung pasyente, mag-desaturate yung O2 ng pasyente, so magkakaroon ng distress yung patient. So, to prevent that, you need to elevate the head of the bed to prevent pulmonary congestion. Tell the patient to move, okay? Move around to promote circulation. Okay? Now, what else? Nabanggit na natin kanina, meron tayong active passive range of motion. Meron tayong SCD, may dietary modification. May mga IV fluids ba tayong pwedeng ibigay? Meron po. Usually, we can give hypertonic solution. So, hypertonic is always paired with your diuretic. So, the hypertonic will attract the fluid back to the systemic circulation and the diuretic will get rid of that too much fluid in the system. Okay? So, they work hand in hand. Okay? So, yun po ang ating edema formation. Hello, meron pa tayo dito. Who is this? Santos Marie. Hey, Santos, how are you? I miss working with you. Hello to Ian Christopher Corpus. Ayan. So anyway, do you have any questions, guys? Anyway, that's for your edema. And what else? So eventually, if you will have a patient with edema or may mga fluid volume excess, be mindful with their diet, be cautious with their, what do you call this, respiration and O2 saturation. Kaya nga, risk sila for pulmonary congestion. So bakit nga ba risk sila sa pulmonary congestion? Remember, in your anatomy and physiology, the lungs, the pulmonary structures are very permeable. Why are the pulmonary structures permeable? Because that's the site where gas exchange happens. So a slight increase in the fluid volume, there's always risk of pulmonary congestion. Okay? So pag nag-auscultate ka, dapat clear ang lung sounds. Ngayon, pag auscultate mo, may naririnig ka ng crackles. Okay? May naririnig ka ng wheezing sound. Remember, crackles are indications of congestion. Wheezes are indications of pulmonary or airway obstruction. Specifically, that is a form of a partial airway obstruction. Yung may mga wheezes. Pero pag yung pasyente mo nagkaroon sudden aphonia or sudden loss of voice, that is a clear indication of a complete airway obstruction. So wag kang matuwa if initially may naririnig kang expiratory wheezes and then minutes after, tahimik na yung pasyente. So meron na pala siyang complete airway obstruction. That is why as a nurse, remember you need to do your rounds, okay, on a regular basis, and you need to assess your patient. Assessing the patient is essential because if you will not assess your patient, how will you know the appropriate treatment or nursing management to your patient if you don't see them? Okay? So anyway, yun lang po. At anong oras na? May na-miss ko to. Honestly. Na-miss ko to mga ganitong eksena. Oh my God. Anyway, yun lang guys. I'm just trying to familiarize myself with this buttons and everything. Hopefully may oras pa tayo that parang na ako inaantok. And by the way, pagkatapos pa ng aking stay dito sa Illinois, I'll be driving to Las Vegas kasi I'll be moving from Minneapolis to Vegas. So there will be a new residence. Okay, sabi nga nila. So, anyway, tingnan lang natin kung ano mangyayari sa ating career. I'm just excited to go home. I'll see you this coming November. Okay, so hopefully, magkikita tayo this coming November. So watch out. You call your respective review centers for my schedule, especially dyan sa Cagayan de Oro City. Call Ma'am Amor. And then, tingnan po natin kung ano yung schedule ko dyan. But definitely, I'll be there this coming November. Okay? So, thank you so much. And I hope you learned something, guys. God bless. Good night, Philippines. Good morning here.